Good morning, ladies and gentlemen. My name is Zalewska-Janowska, and I am the head of Psychodermatology Department in Lodz, Poland. My assistants shall perform a very interesting studies on the female patients who underwent aesthetic dermatological procedures. And what appears in today's world, we should remember that more and more patients are searching for aesthetic dermatological procedures. And performing such procedures, which are always invasive, is very important. However, should be remembered that actually in today's world, a lot of people have a lot of problems. Such times. So we actually decided to check whether these patients, and we selected 40 women who were undergoing different aesthetic procedures in dermatological outpatient department, whether they have any psychological problems, and we measured level of anxiety and depression. We used hospital anxiety and depression scale, HATS, and we also used the scale evaluating perceived stress of the patients, PSS-10 scale, and detailed questionnaire, such as demographic ones. And then we statistically checked all the results. And what appeared, I must tell you that actually I was quite astonished with the results, because actually those patients show quite high levels of anxiety and depression. And there was no correlation with the number of procedures, aesthetic procedures the patient underwent, with the level of anxiety and depression. We thought that maybe the more people go for procedures, for dermatological aesthetic procedures, there could be more problems, psychiatric ones even, such like body dysmorphic disease, but it did not appear. However, the level of anxiety and depression in this group of patients was quite high. So, for our clinical observation, it's extremely important, once we are in aesthetic dermatology, always to interview in depth the patients, because maybe the patients, especially females ones, and as we know, females are expected to look nice, and the level of expectation from the society is quite high. So females are more at pressure of looking nice. And those ones who are going for procedures could have different problems as for psychiatric or psychological approach, and maybe not aesthetic procedures can solve these problems, but a psychiatric approach, and could be of help and could give better results. So in conclusion, the increased level of depression and anxiety among aesthetic patients suggest that the problems they face cannot really be only resolved by going for aesthetic procedures. The issue is much more complex. So, holistic view to the patient, biopsychosocial approach, coming back to the Hippocrates time,